We're going to talk about inhalers because we use them frequently in the sim lab, and I want everybody to kind of see how they're used and indications for why they're used. So maybe if you guys hear me tell Ashley how to use the inhalers, it might kind of stick a little bit better. And so I'm going to start with albuterol. So we've already went over nebulizers. So now I'm going to talk about an albuterol inhaler, okay? And some of your simulations will have albuterol inhalers as an ordered medication that you have to provide to the patient and educate them on how to do it. And so there's this misconception that when you get an inhaler, you are supposed to open it up and quickly shake it, and then I'm going to pretend like this is my mouth, stick it in your mouth, and then do what's called this real quick breath where you go like this, right? And you can see when I sprayed it, I don't know if you see it in the video, but all of the medication went right here. Nothing came down, okay? And the reason why it did that was because I took a breath right when I sprayed it, which means I closed my airway and I wasn't able to get it to come all the way down. So what you're supposed to do is this fancy word, it's called a coordinated breath hold. And rarely do people get told to do this properly. So when you're giving a patient education on an inhaler, and they're not going to use a spacer, which we'll go over here in a second, you want to tell them to make sure that they know how many doses were originally ordered, because on the back of this is going to be a counter, and sometimes the pharmacist or the pharmacy or when you get it from the pharmacy at the hospital, they may or may not prime the medication. So there's a propellant in here that allows it to be expelled from this canister. And so if it wasn't primed, the first time they push this down, they're just getting propellant. So we gotta make sure that the medication, the substance that's coming out of the hole from this canister is actually albuterol, right? So what I tell people to do is, if they were ordered, let's say 184 doses in this, I would look back here and it says on here 182. I know you can't see it, but I'm telling you that there's 182 doses on here. So that means that it was already primed twice. 2 doses were used, and that is something that you'll see on the counters. So let's say the medication has been primed and it's ready to be given. So when I'm instructing a patient on how to use this, I'm going to tell them that you're going to use this based on the order of what the doctor has ordered it on. So typically an albuterol inhaler is a rescue inhaler. All right, it's fast acting. It's going to work right away. It's a bronchodilator, so it's meant to dilate those airways so that they can take a deeper breath and allow more oxygen to get down to the alveoli. So when they do this, the same side effects can occur as a nebulizer. So you want to make sure that you educate them on that. So a coordinated breath hold is basically when someone kind of takes a short breath first, just a little one, and then they stick this in their mouth and they push down the button here, the canister, and when they push it down, they complete that inhale. So they have to do what's called a coordinated breath hold. So they're taking a breath, a small breath, to open up their airway a little bit. They push down the canister and then breathe in the rest of the way so that the medicine can deposit all the way deep. Now, most of the time, the medications will be ordered 2 puffs, like Q2 or Q4 or PRN for shortness of breath and wheezing, something like that. So you want to make sure that the patient knows to take a 1-minute break between squirting this. If they're doing this, I'm going to show it to you, right? Who knows how much of that medication they actually were able to get deep into their lungs. So you want to make sure that they do 1 and then wait a minute, see how they feel, see if they have any like weird side effects. Do they feel like extremely dizzy? Do they feel extremely, jittery? those side effects we kind of need to know about before they give them another dose, all right? And so they wait a minute, they feel okay, and now they can do it again. And now that second dose is going to get even deeper because the first dose already started it. So that's why there's got to be a 1 minute hold. Now, let's say the patient just cannot maneuver that coordinated breath hold. So we have what is called a spacer, all right? And that's kind of the generic name, but there's aerial chambers, they're all different names. But typically, it is this fancy tube here, okay? And it has a one-way valve in it. So when I take the cap off, right here is a one-way valve. So the aerosol from the inhaler is only going to come out of the tube when the patient sucks on the mouthpiece or inhales, all right? And so most of the aerial chambers or spacers, they have sort of a mechanism that will make a humming noise if you breathe too fast. I wanted to confirm with this aerial chamber, so when the patient breathes in on this device, if they breathe in too fast and too hard, they will hear a harmonic sound, and that is not good. We don't want to hear the noise, so go ahead and simulate that for me. All right, so in that event, she's breathing too hard and too fast, and the medication is not going to be getting to her in a therapeutic way. So if you hear that noise, you have to slow down your breathing so that you don't hear the noise. So in this situation, we would push the button in here, and so I'm not going to push it because this is albuterol. So we would push the button down and the medication will go in the tube. All right, so let's say I pushed it down and now there's medication in here. So Ashley, what I want you to do is take a slow breath in, and you can take a couple breaths on it just to make sure that you get all the medication. When the medication goes into your mouth, I want you to kind of just hold it for a second and then breathe. Take another breath and then hold it and breathe. And up to 3 breaths is usually pretty sufficient. Good. Okay, so with that medication, your doctor ordered you on 2 puffs every 4 hours as needed. So we're just gonna wait a minute, see how you feel. And you let me know if you're feeling like, really jittery. This is a fast acting medication, so it should work really fast. And like I said, people do feel jittery. Sometimes they get a headache from it. After about a minute, we're gonna do that again. So the instructions are to push down the canister, allow the medication to fill the canister, put it in your mouth, and then repeat your breaths just like you did last time. Perfect. Now, just make sure that when the patient gets done doing that, they recap their inhaler so that nothing gets inside of it. And cold air actually depletes the canisters. So don't leave this in your car in the wintertime, because then you'll come to an empty inhaler. Also, extreme heat is not good for it either. So just sort of keep it in a room temperature room. And then make sure you're watching your counters so that you know how much is in here, so that you aren't going to get it when it's empty. It's not going to do you any good if there is no medication inside of it. As far as this spacer is concerned, this is obviously Ashley's spacer. So we always tell people to rinse them out with hot water and just let them air dry. Don't clean it out with any rags or paper towels, because then those little particles can come off inside there, and then the patients can actually breathe that in. So we don't want them to do that. You'll also see that these come in different colors, and sometimes you'll see a mask on the end of it, and we actually use that for babies and children So when we put it on their face, they can't do a coordinated breath hold either. So we put it on their face, and it sort of, it looks like a mask that we put like on an ambu bag or something like that. And we will push the canister down, and then the baby, as soon as they breathe, the medication will come out just like it did when Ashley did it. It'll come through the one-way valve. The baby will eventually have to breathe in through the mask. Now, it does sort of look horrific when an RT has to administer an inhaler with a masked spacer, because typically we have to put it over the baby's face, which they're scared, and then we do not remove the mask from the baby's face until they breathe in, which is when they're ready to scream and in terror. And so sometimes you might see these used with kids in the event that we can't get a nebulizer to them right away, but we do need to have some sort of a rescue medication on hand for them in the event that they're in respiratory distress. So that is typically how you're going to use an inhaler. This is the boot style, and a lot of medications, a lot of inhalers come like this. You need to know your class of medication. In SimLab, the patient is always going to ask, what is this medication? What does it do? How fast is it going to work? You can always expect in SimLab us to ask you that for every medication that you give, especially respiratory medications. So just keep that in mind. We're also going to review medications that look like this. This is an Advair, and it's typically purple, and this medication is a corticosteroid, and it's also a dry powder inhaler, okay? So dry powder means that the patient is actually inhaling a dry powder that is in some sort of a capsule. So when we open this, like this, and then we pull this lever down, what we've just done is punctured a little capsule that has powder in it. And so when we do that, we have opened up, we've punctured the hole in the capsule so that the patient, when they put their mouth on this, they will actually breathe in that dry powder. And so that is the main reason that when you do a dry powder inhaler, you have to rinse your mouth, because typically that powder is going to go right to the back of your throat. And if it's a corticosteroids that are inhaled can cause thrush, a yeast infection. So that is why we rinse our mouth and gurgle and spit it out for inhalers like this. So the instructions for how to use this is basically you want to make sure that you know why you're using it. So actually this is Advair. This is 100/50, and this is a corticosteroid, which means that it is a steroid that is going to reduce the inflammation in the airways, okay? So there's inflammation in there from your COPD or asthma, and so what we want to do is reduce the inflammation so that there's more airflow, so that our bronchodilator, when you take your nebulizer, the medication can get deeper, and that's how that works. So you always want to make sure that when you're giving your medications, if you're going to give a dry powder inhaler, we want this to get down deep, but the way to get this deep is to dilate the airways so that it can get down there. So you have to give a bronchodilator first before you give an inhaled steroid, because otherwise it's just going to hit the back of the throat, because there's no road to get down there. So bronchodilator to open the airways, and then the corticosteroid to reduce the inflammation so that the medications can continue to work and they can oxygenate, and the alveoli at the bottom of the lungs are having enough gas exchange. So that is why we tell patients to rinse their mouth and what it does and all that kind of stuff. So when we do it, we open this up, and then I'm going to tell Ashley, I'm going to, when I pull this down, it's going to puncture a pill in here. And what you're going to do is you're going to put your mouth on here, and you're going to take a deep breath in. It's going to be like this. And you might hear like a little flutter noise in here, and that's normal. and then I want you to hold it for about 5 to 10 seconds, as long as you can, really. All right, and then when we get done, we're gonna have you rinse your mouth so that you reduce the risk of getting thrush.
Okay.
Okay, so I'm not gonna put this on her mouth because we put this on every single simulator's mouth, but if she did, I would pull this lever down, I would tell her I'm gonna put it into your mouth, and you're gonna take a slow breath in. Perfect, hold it for 5 to 10 seconds, or as long as you can. And good. And then we're gonna close it, and we're gonna say, okay, I need you to take a drink of water, and you're gonna take a drink of water, and you'll see some patients who are used to doing this medication. It is a maintenance medication. It is not going to fix your problem right now. This is not like your Albuterol inhaler. This is long acting. So this is something that you're gonna take every day, morning and night typically, and it works over time, okay? So this, I never want you to take this if you're having an acute asthma attack or acute attack. You need to use your Albuterol for that. This is maintenance, okay? So make sure you tell your patient that, so that they're not using the wrong inhaler when they're in a moment of distress.